Do you like to eat? Well, listen up, because Metropolitan Washington Restaurant Week, presented by Restaurant Association Metropolitan Washington, returns to wrap up the end of summer from Monday, August 28th through Sunday, September 3rd, and leads into DC Jazz Festival. Metropolitan Washington Restaurant Week is the area's signature dining promotion, with 250 plus restaurants participating, including first-time participants at DCA and Dulles International Airport, expanding the promotion to all arriving and departing our region for summer travels. Just go to the Restaurant Week website at rwdmv.com to view participating locations, menus, and to make reservations. Today on CityCast DC, welcome all of you here to our live taping at Sonny's Pizza. Oh, this is gonna really turn that enthusiasm around, because now I have to finish the intro. And today we're talking about an important issue, COVID summer surge. The hospitalization rate in DC rose 29% earlier this summer, but it definitely doesn't feel like a pandemic out there. Everything's open, people are out and about. So how seriously are we supposed to take all of this? Politico's health reporter, Chelsea Cirruzzo, is here with me, and my co-host, Michael Schaefer, is here to discuss. Today is Wednesday, August 30th. I'm Bridget Todd, and here's what DC is talking about. Thanks for being here, Chelsea.
Thanks so much for having me. I love Sonny's, and I love you guys, so I'm happy to be here.
It is very mutual. I don't know about y'all, but I have been reading so much about this surge in COVID numbers in DC. Have y'all heard about this? And so something that is kind of tricky about this conversation is that, we're in a pandemic, we're still in a pandemic, but out on the streets, it doesn't necessarily feel like we're in a pandemic. So hopefully, Chelsea, you can shed some light on what's happening, why it feels like maybe it doesn't feel super pandemic-y out on the streets, but we are still in a pandemic. What's going on?
Yeah, I hope so. I know we all hear COVID and we're like, oh my God, I can't do this anymore. But it is important to talk about. So I appreciate you guys all listening. There has been a rise in hospitalizations nationally. And looking at DC's own numbers, and this is new hospital admissions for COVID. So that's when somebody goes to the hospital for COVID. There has been an uptick starting in mid-July, according to the CDC. It is worth noting that this uptick is about a quarter of what we saw about 1 year ago at the same time.
Wait, so 1 year ago, i.e. at a time when people also thought we were not in the pandemic,
Yep.
It was 4 times what it is now.
Yeah, it was more, definitely. So, we are seeing a similar rise at that time, but not as great as before. That said, there are, some nuances here. COVID changes pretty rapidly. I'm sure you guys have seen the variants, which are, named like I name my resume on my Word document. So we do know that this hospitalization is likely driven by 2 different variants, one being XBB 1.5 and the other being a newer variant called EG5, which has also been dubbed Eris. So we do know those are things that we're looking out for, and that's probably where this rise is coming from.
So what does this mean for us at this stage?
Yeah.
Given that, Washington is a place with fairly high vaccine participation, with fairly conscientious people. Talk to me about sort of what this means for DC specific.
Yeah, of course. So earlier this year, we had COVID centers. I don't know if anyone remembers COVID centers. That's where you could go, get a test, get a vaccine, get a mask. We don't have those anymore. So, from the experts I've spoken with this year, it kind of really comes down to a lot of personal choice and being proactive, right? Going to your doctor, going to your pharmacist and asking, do I need to get an updated shot?
Have you guys noticed people behaving differently in the last few weeks? Since the surge has gotten more news?
Yeah, I'm seeing more people masking, which is great. Mm-hmm. I'm seeing more people thinking about COVID. I know at my doctor, it used to be all masks, and then it was kind of like masks optional, kind of got real loosey-goosey. And then going back to the doctor, they were back doing masks required. And so, yeah, it is. I have noticed that. Have you?
Yeah, my friends, it changes, I might, have plans with a friend one night, but they had another friend who got COVID and they're not so sure anymore. And we just decide, we're not going to hang out. We're just going to wait, which is nothing that we stopped entirely, but it has come more into the conversation. But it's interesting. Like you said before, these changes might be happening, but we don't have the COVID centers anymore. And, school just came back. And in the past, students have had to test ahead of coming back to school. And that hasn't been a thing as much this year.
I'll say, just as a parent of kids, I don't notice any change. Like people at play dates are hopping, and the only thing I've noticed personally is, so I've got this thing where I'll get these coughing jacks for 5 minutes of really, and I've been tested, it's not COVID. But when that has hit me, in public, the looks of hatred and disdain I get from my fellow humans.
Those are looks from me. I'm the person who's on the other end of those looks.
I'm sitting next to him.
Because this is a long-standing thing, and those looks have gotten much more intense the last month or so.
Yeah.
Wait, what percentage of us are currently vaccinated and boosted?
Most of DC residents have gotten at least one shot. Booster uptake, the bivalent booster, which was last year, is a little bit less so. I think only a third of DC's population last year got that shot. So your initial shot will protect you, but the boosters are what keeps you continuously protected, like a flu shot, right? It's engineered towards the variant that is out there.
I want to talk a little bit about that because, you mentioned that we used to have COVID centers, testing and boosters and things like that was kind of ubiquitous. It doesn't really feel like that is the case anymore. Is it right that they stopped? If you wanted to get a COVID test now, you just have to pay for it out of pocket, or your insurance would pay for it?
Yes, you have to go to a store, you have to buy one. It is much harder, right? I mean, I used to walk into the library, get tests, but now, yes, it is up to you to pay for them and to request reimbursement through your insurance. When it comes to if you're uninsured or maybe, you weren't able to get to a CVS, I spoke with DC Health today, and they told me that they took their stockpile of tests and masks and gave them to community organizations, which they say will be handing them out at their events, but they didn't really give me much more information on who they are and where to find them.
So if you're paying for tests and it's up to you to do the, I'm sure, pile of paperwork to get reimbursed and wait forever, it does seem like something that would be a real barrier to this thing that the city and I think, officials are telling us we should be doing, but we're not going to give you a lot of help figuring out how to actually do it.
Well, and it's like a throwback to the early pandemic days when it was really hard to get a test.
Oh my God, yes.
Remember that? Those were the days.
Has anyone tried to navigate this process of getting a test when you thought you might have COVID recently? Yeah, I'd love to hear about how that process was if you're comfortable sharing.
I'm Kayla. I'm also a CityCast DC, but I got COVID several months ago, so it's not, it's a while ago. But I was trying to find a PCR test, and I had to drive. Luckily, I have a car all the way out to Maryland to get the test, and I went to a CVS, and it took an hour and a half. I had to take half a day off. It was just a whole disaster, and you're feeling sick. It was not fun.
Thanks for sharing, Kayla.
I have a story I want to share about COVID test.
Please.
The United States Postal Service, do they not still do the thing where they send you COVID test in the mail?
Yeah, that's a good question. So they have not said that they will do so this year, though recently, like it was mentioned earlier, I'm a national health reporter. Recently on a call with reporters, HHS said, that's the health department. Sorry, I get very nerdy about this stuff. They did say that they do still have a stockpile, and they do still have contacts with the U.S. Postal Service, though they didn't commit to saying that they will be sending those tests out. So that's something that I'm watching as a reporter.
Speed into success. Learn French. Much like a high-speed train, our immersive classes propel you toward fluency. Master the French language swiftly and smoothly, and unlock a world of personal and professional possibilities when you become a member and learn French at our renowned Alliance Française chapter in DC. Tradition and modernity intertwine, offering you an unparalleled learning experience that includes language classes, cultural events, and the only lone library in French language in the Mid-Atlantic region. Embrace the language that bridges cultures and enriches your resume. Enroll today. The fall session starts on September 16th. All ages and levels welcome. And if you sign up by August 31st, you get $20 off the tuition. After all, we are the French heartbeat of the nation's capital. Find us at www.francedc.org.
Wait, so what do we know at this point about long COVID?
That's a good question. And it's hard to say. Every time I talk about long COVID, and I've been reporting on it for a few years, I always feel like I get stuck saying we still don't know a lot, and that's just the truth, right? We have learned more and more over the past few years, but there's still a lot of mystery when it comes to long COVID, which are lasting symptoms like fatigue, like respiratory issues that last beyond the initial infection. A recent study did come out from Nature Medicine that found that people with long COVID, and this was a study of people who got a COVID early on in the pandemic, still have symptoms 2 years later. Which is stark. It's hard to hear. And, I recently read an op-ed from an author I really like, Madeline Miller, who wrote Song of Achilles. Great book. Please read it. But she mentioned having long COVID, and she talked about how it kept her from doing her writing. And it struck me because I'm a fan. I want her writing out there. And it struck me just how hard it can be to have long COVID. So it's scary that we don't know that much, but it's something I continue to think about, and I hope others are thinking about as well.
Yeah.
All right, so we are here at Sonny's Pizza. Beautiful, like outdoor covered patio area. There's, I see hand sanitizer on a bunch of the tables. Is there like a sense of what best practices ought to be now to accommodate life in this current surge?
I did speak with DC Health, like I said before, and they, gave the same advice we've been hearing for the past 3 years. Wash your hands, wear a mask in crowded areas. Don't leave your house if you're sick. And that includes if it's the flu or RSV, those are also concerns. Or even if you think it's a cold, you never know. So be more conscientious of that going forward.
Yeah. I should share. I mean, I was really resonated with me what you were saying about long COVID. I have long COVID. It sucks. The person that you were talking about, how it impacted her ability to write, definitely identify with that. I will say one thing about having long COVID is that when I first got diagnosed with long COVID, a lot of people, like people that I worked with and people in my circle were like, oh, that's so hard. And like, I felt like a lot of like support around it. I think it's one of those things where at a certain point, people are like, I don't want to hear about your long COVID. Like, it's not really the kind of thing that I think it mirrors how we dealt with COVID generally, where at a certain point, people just decided they don't want to talk about it anymore.
It's an annoying affliction.
Yeah, like they wanted to get on with their life. And it's interesting to me how it was such a big part of our lives and how quickly people just kind of move on.
So speaking of big parts of our lives, you say there's going to be another booster.
Yes.
And I assume that that's going to bring with it all of the agita that the previous boosters did. What should we expect in DC? Where will that be delivered? Will it be free like the other ones? What's the story?
Yep, that's a great question because it is going to be different this year. I didn't mention that there is one variant that the CDC is also watching, which you might also have heard about, which is called BA 2.86. It's important to just understand these variants because when we're thinking about the two dominant ones, those are the ones that our upcoming fall booster is going to be engineered towards. This new one, we don't know very much about it. We don't know how effective the booster is going to be. So something to keep an eye on. The CDC has identified 2 cases in the United States. So the other dominant ones are more important. So the administration, the Biden administration, big national, they expect that the updated COVID shots should become available by mid to late September. So hopefully sometime next month. DC did tell me they've already ordered the vaccines, which they will give to both public and private providers. Now, the difference this time around is, yes, you do need to go through your provider, through your doctor to get it, or through your pharmacy and give your insurance to get it. That doesn't mean you'll be paying for it, but you do have to make sure your insurance is involved. If you're uninsured, it gets a little bit harder and it gets a little bit more confusing. I do know that the national government is working on getting an uninsured program into pharmacies. But as my colleagues at Politico have reported, that was happening a lot slower than for the insured program. So since my colleagues last reported on this, we do know that federal officials are moving faster to get the uninsured program into pharmacies, but that's something we're also watching. So when the time comes, you'll have to go to your doctor or go to your pharmacy and to get your shot.
Chelsea, thank you so much for being here. And thank you for following this story. I mean, I know it's a tough one to stay on top of, but we really appreciate you sharing your insights with us today.
Yeah, of course. Happy to do it.
Give it up for Chelsea. And before you go, here's some quick news. A bomb threat caused the evacuation of the National Zoo on Tuesday morning. Police searched the park after the threat came in at 10:40 a.m., but they found nothing suspicious. Also, D.C. will pay $5.1 million to gun owners and attorneys after a judge found that certain local gun laws violate the Second Amendment. More than 3,000 people qualify for payment through the class action lawsuit. The unconstitutional law in question banned carrying handguns outside the home and banned non-residents from carrying guns at all in D.C. And lastly, officials are starting the process of building a new bridge between Virginia and D.C. to reduce train congestion. Preliminary soil testing will begin for the Long Bridge project on the Potomac River. The estimated $2.3 billion project is meant to double the capacity of passenger rail between D.C. and Virginia. That's all for today here on CityCast DC, and a big, meaningful thank you to everybody who came out to our live show at Sonny's Pizza. We'll be back tomorrow morning with even more news from around the city. Talk to you then.